So for the purpose of the exam, you must know these three types, these three cancers, skin cancer: squamous cell carcinoma, basal cell carcinoma, and malignant melanoma or melanomas. So I started with the squamous cell carcinoma, and I say squamous cell carcinoma, most of it originate from the actinic keratosis. So the actinic keratosis, you can say, is the baby, is benign, is benign, and it's always on the elderly with fair skin. Okay, you can see it is always on the dorsum of the arms, of the forearms, or sun exposed area, face, neck, hands, and you can also see it on the head. So always on the sun exposed area, and we say that it's always dry. You can see the picture is dry, and sometimes it can be round, it can be red, but always remember it's dry, sun exposed area, and we say is a precursor for squamous cell. So if you don't take care of actinic keratosis, it will lead to squamous cell carcinoma. So sometimes what you will hear from a patient is that they will say, "Oh, it doesn't bother me." And I try to explain to them, yes, I know it doesn't bother you, but then you still need to follow up with a dermatologist, because it's very important that you take care of actinic keratosis, because if you don't take care of actinic keratosis, it can lead to squamous cell carcinoma. So at carcinoma now is a skin cancer, but actinic keratosis is benign. But benign doesn't mean you don't take care of it. Benign means you need to watch it before it gets worse. Okay, so two treatments that we use. Okay, of course, is referral to dermatologist. They're going to do a punch biopsy, and the two treatment that we use is the 5-FU fluorouracil. Yeah, I said it's like a cream, something like this. So if it's in a large area, they use this on that large area. So it's a chemotherapy cream that will destroy the abnormal cells. But if it's on a smaller area like this, on a smaller area, they can do cryotherapy. They can do cryotherapy. But if this actinic keratosis is not taken care of, is going to lead to squamous cell carcinoma, which is the first cancer we're talking about. So we said that squamous cell carcinoma is a non-healing lesion, non-healing. So it can be there for so many years, it's non-healing, and is always firm, is smooth hyperkerotic plaque. So plaque is an purple, sorry, a hyperkerotic purple. So purple is anything that is always raised of the skin. So it's also a nodule. Anytime we use nodule, you are talking about cancer. Anytime we use indurated, so those are the words we use to describe a cancer: nodules, indurated. And you can also use this mnemonic non-sun. So non is a nodules, nodular. O is opaque. S is on sun exposed area. And U is ulcer, is ulcerating. And N is non-distinct border. So, but I differentiated it with basal cell carcinoma, and this is your basal cell carcinoma. So remember that squamous cell carcinoma, we say that it easily bleeds. It easily bleeds without trauma. It easily bleeds. It's a sore that bleeds. It does not heal. Okay, so we have, of course, we are not going to do the treatment because we are going to refer them to dermatologists. Then we have the basal. So how do we describe basal? Basal is waxy, pearly shaped, with telangiectasias. Telangiectasias is those tiny, tiny blood vessels. So of course, this is non-healing lesion too, and it bleeds frequently. It bleeds frequently after minor injuries. But if you compare the basal cell carcinoma and squamous cell carcinoma, basal cell is most common. This is high yield in the exam. Most common type of skin cancer, basal cell. Basal cell will rarely metastasize, spread. Squamous cell is more aggressive. It's more aggressive. It can metastasize. That means it can spread. So basal cell is non which is slow growing, and like we said, is pearly, shiny purple, road borders, telangiectasia. But squamous is always scaly. So even if you don't remember, just remember it as a basal cell have borders, road borders, B for border, road borders with telangiectasia, and it's pearly shaped. But squamous S is scaly, S is scaly. Okay, it may be painful, it may be painful. So always remember that more aggressive than basal cell. Basal cell is most common. Then when you compare it with melanoma. So the melanoma, uh, we say the ABCD melanoma, the melanoma. So the melanoma one, you always remember it with A. A is what? A is your asymmetrical. That it means it's supposed to be size of pencil eraser, but asymmetrical. Sorry, asymmetrical is one side. Asymmetrical. Whenever you hear something asymmetrical, it means one side. Asymmetrical. Then the border is irregular. When you look at the pictures, is irregular border. You cannot really define the border. It's irregular border. Then the color variation, it can be red, it can be so different color, black. Okay, different color. Then the diameter is the one that we said is greater than 6 millimeter, which means it's greater than size of a pencil eraser. Is greater than that. So and E is that it's evolving, is elevated, is evolving, is elevated. And the treatment is usually excision, excision. And then we have other skin cancers, but for the purpose of the exam, the another one we can talk about is just the Merkel cell carcinoma. I know there are other carcinomas, Kaposi sarcoma, the one we always see with cancer. But just for the purpose of emphasis for the exam, the next cancer is the Merkel cell carcinoma. Merkel cell. So the Merkel cell carcinoma, they are rare but very aggressive. Rare and very aggressive. Okay, they are firm, painless, red, violent nodules. Okay, the word again, nodules. So what to always remember here is that is fast growing, painless nodules. So from the Merkel cell carcinoma, Merkel cell carcinoma. So always remember that Merkel cell carcinoma. So we say that a Merkel cell carcinoma is painless and is on sun exposed area and has a red. I know sometimes the picture may not show it perfect, but it has like a red violet nodule. That is the third. That this one is the fourth cancer. Remember, squamous cell first, basal cells second, melanomas third, and Merkel four. And like I said, we have other ones, but we are focusing on primary care. And that one, the last one, but not the least, is the Kaposi sarcoma. That is another skin cancer. The rest, we don't need to look into it. So I believe everybody knows about this one. This one has always to do with people that have is always associated with HIV, immunocompromised. So they have a purple skin lesion. purple skin lesion. So anytime we talk about sarcoma, Kaposi sarcoma, so it always has to do with HIV or immunocompromised. It can be on the face, it can be inside the mouth, and it also can be on the leg. But just remember that that is your sarcoma, Kaposi sarcoma. So it always just remember it is the purple skin lesion. Purple skin lesion. So these are all your skin cancers for the purpose of the exam. We started with squamous cell carcinoma. From squamous cell carcinoma, we did the basal cell carcinoma. From basal cell carcinoma, we did the malignant melanoma. So anytime they ask you question about ABCD of skin assessment, you know they are talking about melanoma. Then the next one is the Merkel cell. We say that the Merkel cell has a painless red nodules. Painless. That buzzword, painless. Then you have the Kaposi sarcoma, is the purple skin lesion. Purple skin lesion. So those are your skin cancers, and it's very important and very high yield.